Hello everyone, this is Vipul Purohit and you are watching my YouTube channel. My dear friends, I hope you all agree with me that the year 2020 was one of the worst year. Yes, it was with reference to the corona pandemic. We are in the initial stages of the year 2021 and it has been proved a landmark, of course in a positive sense. Yes, I am referring to the design and the approval of the corona vaccine. My dear friends, this is one of the best efforts to make sure that the entire world becomes corona free. But at the same time, I'm very sure that there are so many questions revolving around your mind as far as this particular vaccine is concerned. So my dear friends, let's have the different questions related to this vaccine and also the solutions of it. So please go through it very carefully. How many doses of the vaccine would have to be taken and what would be the time interval? 2 doses of vaccine with an interval of 28 days need to be administered by an individual to complete the vaccination schedule. When would antibodies develop? Generally, the protective levels of antibodies are developed 2 weeks after administering the second dose of the vaccine. The next question is, what about the side effects of the vaccine? The possible side effects could be in the form of mild fever, body aches, etc. These side effects are with any vaccine. Means not necessary it's only with corona vaccine, it can be with any vaccine. However, the states are directed to make necessary arrangements in dealing with the side effects in order to ensure safety of the vaccine. The next question, can a person presently having COVID-19 active or symptomatic infection be vaccinated? The answer to this is, preferably such patients should avoid vaccination for 14 days after the infection is cured, as it may increase the risk of spreading the infection at the vaccination sites. The next query is it necessary for a COVID recovered person to take the vaccine? Answer is yes. The vaccination will definitely help in boosting the immunity against the infection. The next question, is the vaccine safe along with medicines for illness like cancer, diabetes, hypertension, etc.? The answer to this is yes. These patients are in the category of high-risk groups. The medicines will not affect the effectiveness of the vaccine. The next question is, will the vaccine be safe as it is being tested and introduced in a short span of time? Yes, the vaccines are introduced after the approval from the regulatory bodies only after the various stages of trials. We have the next question, will the vaccine introduced in India be as effective as the ones introduced in other countries? Yes. Various phases of trials have ensured that the safety and the effectiveness of the Indian-made vaccine is at par to those of other countries. The next query is, out of the multiple vaccines, what would be the basis of selection? The answer, my dear friends, the vaccines which are approved by the regulatory bodies have comparable safety and efficiency. However, it is recommended to use the same type of vaccine during the entire vaccination schedule. Next question, which are the priority groups selected for vaccination? There are 2 groups. First group, healthcare and frontline workers. The second group, people with age of 50 plus and below 50 with co-occurring conditions. The next important query, is vaccine administration compulsory? Answer to this is plainly no. It is voluntary. Nevertheless, it is advisable to take it so as to ensure the safety not only of oneself but also of our nearest and the dearest. Next, is vaccination possible without registration? Answer is no. Registration is compulsory. The government has announced Co-Win app, a digital platform for real-time monitoring of vaccine, and will also enable registration for vaccine. The next question is, what are the documents required for registration? Any of the below mentioned ID with photo may be produced at the time of registration. Aadhaar card, driving license, health insurance smart card issued under the scheme of Ministry of Labour, Manrega job card, official identity cards issued to the MPs, the MLAs, MLCs, PAN card, passbooks issued by the bank or the post office, passport, pension document, service identity card with photograph issued to employees by the central or the state government or PSUs or public limited companies, voter ID, smart card issued by RGI under NPR. Next question. How will the beneficiary receive the intimation about the due date of vaccination? My dear friends, after the online registration, the beneficiary will receive SMS on their registered number regarding the due date, place, and time of vaccination. The next is, will the beneficiary be updated with the status of vaccination after completion? Oh yes, SMS will be sent on the registered number. A QR code based certificate will also be issued. The next question is, which precautionary measures to be adopted at the vaccination site? The answer to this is, preferably taking rest for half an hour after getting vaccinated is recommended. In case of any discomfort, immediately intimate the concerned authorities. The next question, should the beneficiary follow the SMS rules even after the vaccination? Yes, the normal precautionary methods of S for sanitizer, M for mask, and S for social distancing must be followed strictly even after vaccination. And the last and the most important question is, does India have the capacity to store the COVID vaccine at a temperature of +2 to +8 degrees Celsius and transport them at required temperature? Yes, we do have it. The program mechanisms are geared up to effectively tackle the country's large population.